you're watching DD India, and we're back once again with another episode of Wellness Watch, your weekly dose of health, healing, and holistic living. Our spine is not just an accumulation of bones, it is the backbone of our body, literally. It supports every move we make, from bending down to pick things or to standing tall with confidence. Yet, we often take it for granted. A healthy spine is the foundation of overall well-being. Whether we are dealing with occasional back pain or simply want to prevent future discomfort, taking care of our spine today can set us up for a lifetime of pain-free movement. Today in Wellness Watch, we explore spine health and the ways to keep our spine strong. I'm Preeti Kaur. As we wrap up August, Spinal Muscular Atrophy Awareness Month shines light on the rare genetic disorder affecting thousands of families worldwide. This, or spinal muscular atrophy as we say, SMA, robs individuals of muscle strength, but breakthroughs in treatment are now offering new hope. Here's a report on the challenges, triumphs and calls to action. Take a look.
The spinal cord is the most important part of our body. It is a thick bundle of nerve fibers that allows our brain to communicate with other peripheral nerves that branch out everywhere else in the body. The spinal cord connects to the body's spinal nerves, and any injury to it affects the lanes in this expressway. Any kind of damage to the spinal cord not only affects the mobility of a person, but also impacts the overall well-being. It may also lead to loss of essential functions like an autonomic processes. A spinal cord injury, SCI, is caused by a trauma that impacts the spinal cord, causing various symptoms like tumors, degenerative and vascular conditions, infections, toxins, or birth defects. It can also result in a long-term disability. Every year, the month of August marks Spinal Muscular Atrophy Awareness Month. It aims to increase understanding and support for people affected by the condition. Spinal muscular atrophy, SMA, is a rare genetic disorder that causes progressive muscle weakness and loss of movement. It affects roughly 1 in every 10,000 children born every year and is caused by a mutation in the SMN1 gene, which leads to a shortage of crucial motor neuron proteins. It is also observed that SMA primarily affects children. There is no cure for SMA, but certain therapies and medications can help manage symptoms. But first, we need to understand the symptoms of this rare condition. The most common symptoms of SMA are weakening of muscles, especially in the arms, legs, and trunk. They can even lack the basic strength for normal movement. The affected children or adults can be seen struggling with daily activities, including to sit up, crawl, walk, or stand due to reduced muscle control. As the muscles around the chest and throat weaken, it makes it hard for the affected person to breathe deeply or swallow safely. There is a noticeable and involuntary twitch or shake in the muscle fibers. As the weak back muscles are unable to hold the bones, the spine of a person suffering from spinal muscular atrophy may bend abnormally, causing joint problems. Not being in use, the muscles visibly shrink and become thinner. As science is advancing, several treatments are offering new hope in the cure for various spinal cord injuries. Effective prevention, treatment, rehabilitation, and ongoing healthcare are essential to alleviate the global burden of SCI. There are multiple options available for treatment of the spinal cord injury. They include spinal deformity surgery, a treatment for conditions like spinal stenosis and fractures. Another option available is minimally invasive spine surgery, which is a specialization offered by several hospitals to provide less invasive surgical options. There are also traditional methods like the spinal fusion discectomy and laminectomy that are effective in herniated discs, spinal stenosis, and fractures. A cell therapy is regenerative medicine approach that uses stem cells to promote nerve growth and functional recovery after spinal cord injury. One must also opt for rehabilitation along with the treatment that includes multidisciplinary care with the help of physical therapists, occupational therapists, psychologists, and nurses. The treatment to any spinal cord injury needs long term support through outpatient phases and yearly evaluations to maximize patient function and independence. Recovery is not just physical, it's about emotional resilience and reintegration into society. Rehabilitation plays a key role, often beginning immediately after injury and continuing for years, that helps patients regain independence and quality of life. Whether it's a rare genetic disorder or a traumatic injury, every story matters. Every step forward is a step towards a better future. The message thus is clear. Greater awareness leads to early diagnosis, better care, and stronger support systems, not just for rare diseases like spinal muscular atrophy, but also for life altering conditions like spinal cord injuries. Bureau Report for DD India.
All right, so August is observed as Spinal Muscle Atrophy Month. It affects alpha motor neurons, the nerve cells in the brain and spinal cord that send signals to the muscles. Without proper signals from the major neurons, in fact the motor neurons, the affected muscles don't get used and get smaller and weaker. Symptoms of spinal disorders include pain, numbness, tingling and weakness in the arms, legs or back, along with stiffness and balance issues. More serious symptoms can involve loss of bladder or bowel control, paralysis, loss of sensation, deformities like curved spine, and persistent pressure in the head, neck, or back. Today in Wellness Watch, we look for these answers. Is spine health important? What are the symptoms of a bad spine, or how to know if the spine is healthy? What are the types of spine disorders? We will also explore tips to maintain spine health and also what medical advancements have been made in India. All right, India offers cutting-edge technology, experienced specialists and comprehensive care at hospitals. Spine treatment in India offers advanced options like minimally invasive surgery, robotic surgery and spinal fusion, along with non-surgical options like physical therapy, steroid injections and platelet-lysate therapy for a natural alternative to steroids. Up next on your screens, we will have some medical institutions and hospitals across the country. All India Institute of Medical Sciences, Delhi, Indian Spinal Injury Centre, Delhi, Safdarjung Hospital, Delhi, Victoria Hospital, Bangalore, Rajiv Gandhi Government General Hospital, Chennai. To help us get more clarity on spine health, we're joined in by doctors today. We're joined in by Dr. H.S. Chabra, spinal surgeon. He's joining us virtually. And we're joined in by Dr. Matthew Verghese, Head, Department of Orthopedic Surgery, St. Stephen's Hospital. He's there with us in the studio. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. Dr. Verghese, to begin with, I would want you to explain to our viewers the importance of a healthy and a strong spine. Is spine health important?
Absolutely, there is no question about it. Your whole ability to be able to stand upright and to walk depends on your integrity of your spine, your back, your vertebral column and the muscles that support the vertebral column. Human beings have evolved from the quadruped position to the vertical position to walk on 2 feet, and that ability to be upright depends on integrity of the bones that form the spine and the muscles that support the spine.
Right.
All are critical.
All right, Dr. Chabra, given the way we are leading busy lives, spine is something that is neglected until and unless we feel pain or until and unless there is there is a need to look after it. Help us understand what are the early symptoms of a bad spine, or if I put it the other way around, how to know if your spine is healthy.
Well, if we would want to say there are more important ways in that we need to curb the problem before it sets in. So, manifestation of an unhealthy spine may come too late. So, we have to work on spine wellness even before. But the early symptoms of an unhealthy spine would be back pain, which is the most common symptom of spinal ailments. It is second only to common cold in ailments, and it's recognized by the WHO as the most common cause of disability across the globe. So it's that common. So other than back pain, you may have pain traveling down the leg or pain traveling down the arm, depending on whether the pain is in the back or in the neck. And if it tends to grow, then you may have progressive weakness in the muscles. You may also have bowel bladder control. And if, for example, the spine gets injured due to an injury, as you talked about, then there can be partial or complete paralysis below that level of the injury, and all functions of the spinal cord below that level can get affected. Preeti ji, I would only want to add, you mentioned about spinal muscular atrophy month, but 5th of September is also observed globally as the Spinal Cord Injury Day.
Yes.
And that is more to create awareness about the fact that most of the spinal ailments can be prevented if managed properly. But if, for example, we have the ailments, they can be managed well. Even spinal cord injuries, it's possible for people to lead a healthy lifestyle from a wheelchair.
All right, Dr. Varghese, is there, are spine disorders gender specific, or is it a particular age group that is more prone to spine disorders?
There are different conditions that affect the human spine at different ages of life. So there are very common conditions which are present in the senior citizens. These are related to osteoporosis or the bone density that goes on decreasing with age, particularly in women. The women after menopause are more vulnerable to rapid loss of the bone density. So they are very vulnerable to osteoporosis. In the young age group, less than 5, these are all birth defects, particularly spina bifida and the other related conditions that are there. Of course, there are genetic conditions like spinal muscular atrophy, which leads to weakness of muscles secondary to the neurons being damaged. The adolescent and the age group where somewhere 15 to 30, they may be vulnerable to what are known as spondylolisthesis, where there is slip of the vertebra one over the other which can happen. This is different from disc disease, where degenerative disc disease very common in the young adults in the 30s and in the 40s, where the disc is normally, it's a shock absorber for the spine between the vertebrae. When with the shock absorber, it's like a burger. When the container is damaged, the content which is shock absorbing, that leaks out, causing pressure on the nerves and backache. So there are different age groups and the presentation will vary completely.
All right, Dr. Chhabra, when a person suffers pain in the spine, is that the trigger point of a spine disorder? One. And secondly, from drugstores, medicines are easily available and people do prefer taking them before visiting a specialist. When is it the time to see a doctor? And also the topical application medicines are also readily and easily available. Put all this together, when is it the time to see a specialist if a person suffers or experiences pain?
So as we talked about, back pain is the most common manifestation of spinal ailments, but the dictum prevention is better than cure holds special relevance. So we should try to prevent spinal problems by leading a healthy lifestyle. If you get back pain, it is not necessary that you see the doctor immediately. If the pain is not responding to some common forms of treatment like hot fomentation, local gel and some analgesics, then you may want to see a doctor, because the cause of the pain also needs to be localized and that needs to be removed so that recurrent back pain can be prevented. In addition, there are some red flags where you may need to report to the doctor immediately, and these red flags include weakness in the legs, loss of bowel and bladder control, or pain radiating down the legs or the arm, or morning stiffness, pain more when you are lying down at night, mechanical pain which is generally not where you need not see a doctor, will have more pain when you are exerting and you will not have pain after rest. But if it is on the contrary, you should see the doctor immediately. So these are some of the red flags where you need to see the doctor immediately and get yourself evaluated.
All right, Dr. Varghese, when we talk of spine pain, or for that matter spine disorders or back pain, is it always serious enough to that it has to be managed by surgery only? One, and at the same time, to what extent do alternative treatments like say physiotherapy, acupressure, acupuncture, or for that matter pain blocks, to what extent do these alternative therapies help in managing spinal disorders?
Yeah, it's important. If you really see, as Dr. Chabra mentioned, it's a very common condition. 4 out of 5 of every human being in this world will suffer backache sometime or the other. So they all don't need to rush to a doctor, but the healthcare system will be totally overburdened if everyone were to go to a doctor for a common cold or a backache. So that is not there. But it's important for you to recognize the fact that when are the red flags on and when should they go in for help. Most of the backaches are usually muscle related, may be related to excessive mechanical stresses on the back, and therefore they normally are self-limiting. Majority of them are self-limiting. It's only when the backache is persistent, say for example, it's not going, you have to think in terms of early morning pains are inflammatory related to arthritis, like ankylosing spondylitis, rheumatoid arthritis, neck pain, rheumatoid arthritis, early morning pains. The mechanical pains are always worse in the afternoon or evening related to physical activity. As Dr. Chabra said, if the pain is at night, you are resting, middle of the night you are woken up with pain, you are not able to sleep because of pain, please seek a help of a doctor even before waiting for 4 to 5 weeks. These are mostly mechanical pains which are amenable to a little rest, not prolonged bed rest as before, maybe a day's break, and that's all that is required. Simple analgesis will take care of it. Simple muscle relaxants by local application of heat or cold, any of them would work and they settle without any other intervention. You do not have to rush in for an MRI, you do not have to rush in for an X-ray in most of these mechanical causes of backache.
All right, Dr. Chabra, we did talk of, there is not a need every time for a surgery to be done to maintain back pain. Help us understand, to manage back pain or spinal disorders, do only high intensity workouts help? One, and secondly, if a person is suffering from back pain, to what extent do lifestyle changes help in managing this? Or for that matter, what lifestyle changes can a person make in his day-to-day life, everyday life, to prevent spinal disorders?
See, there are 2 parts of the treatment for back pain. One is managing the pain, and the other is reducing the chance of recurrence of back pain, which is very common if we don't manage the pain well. Very often we treat the pain, but we do not remove the cause of the pain, and that is responsible for the pain coming back again and again. So, as Dr. Matthew Varghese also said, one may not be wrong in saying that 95 to 97% of back pains can be managed with a good conservative treatment, and only say 3 to 5% of them would need a surgery if they are not responding to it, or if there are associated red flags which need a surgery. Now, when we talk about preventing the recurrence, one of the most important things that is there is to have a healthy lifestyle, which includes incorporating sufficient general conditioning exercise in the lifestyle. See, our lifestyles have become far more sedentary than what it used to be, say around 4 to 5 decades ago. And thus the muscles become weak. So we need to incorporate general conditioning exercise like walk, treadmill, sports, aerobics, swimming, dance, jog, run, any such exercise. In addition to it, what is also more important is to maintain healthy postures in one's lifestyle. You see, our jobs more often require long-term sitting, very often working on the laptop or computers, and these predispose to bad postures. We do not have good ergonomics at our workstations, and we maintain bad postures. So if the posture is bad, it puts a lot of stress on the joints and on the muscles, and thus the strain tends to predispose to back pain. So 2 of the most important things that we can do to reduce the chance of back pain setting in, and if it sets in, once it responds for it to keep coming back, is maintain a healthy lifestyle, incorporating sufficient general conditioning exercises and maintaining a good posture. In addition, modern day stress is also predisposed to back pain, because once the pain becomes chronic, the mind becomes sensitized, and very often these psychosocial factors also lead to perpetuation of the back pain. And sometimes if the doctors would suggest you to see a psychologist so that you take care of this sensitization of the mind, that is also a very important component.
All right, Dr. Verghese, can spine disorders also get cancerous?
The spine is a common site for cancers to spread to the spine bones.
Right.
And that's a very, very serious red flag, especially if it is a senior citizen and the person has pain at night, then the person must definitely seek help. At night, resting time pain can be a pain secondary to a cancerous or an infectious disease like tuberculosis. So both these have to be thought of. Cancers do spread to the spine easily, and they can be a sign, first sign of cancer of the breast, first sign of cancer of other parts of the body. So we have to be aware of this. So the doctor will need to check you for this and will investigate you for that. Those are the conditions where you may need an early medical magnetic resonance imaging, or subsequently based on the oncologist prescribing a PET scan or CT scan or those kind of investigations. So these are very, very serious indications for investigating seriously a back pain.
All right, also explain to our viewers what medical advancements have been made in this field and where is India standing on the global page?
So the diagnostic criteria that are available for you to look for these cancerous deposits, the MRIs, early MRIs, contrast MRIs, PET scans, and the very, very modified versions of PET scan and MRIs are available. These are easily done in India, and they are far more economically done in India than anywhere else in the world, and appointments are easily taken, and they can be investigated very easily.
Dr. Chabra, would you also add to it the medical advancements that have been made in India?
So
yes.
Yeah, medical advancements encompass all fields of management of the spine, right from evaluation to conservative management, to surgical management, to prevention of recurrence. So Dr. Matthew Verghese talked about the evaluation aspects. For conservative management, there are good techniques of rehabilitation which are available. Not only if there is back pain, but if a person, say, has a spinal cord injury and has a neurological deficit, then you have various advancements like robotic exoskeletons available, which help in a good rehabilitation for the individual.
Right.
Virtual reality, etc. are also there. When it comes to surgical management, then you can detect any neurological deficit during surgery by having neuromonitoring during the surgery, which makes the surgery very safe. And you have techniques like navigation technology and robotic technology, which helps in ensuring that there is precision during spine surgery.
All right, for our viewers to get more clarity, we will also have a quick myth buster round. We'll have a rapid fire question round, and I request both of you to give short and crisp answers. Dr. Matthew Verghese, is lifting heavy objects the main cause of back pain?
No, not really, not at all. You may have precipitated because of some primary underlying condition, but unusual that you have lifting heavy weights causing the number one cause, no.
Dr. Chabra, does bed rest help in relieving back pain?
It's a very common myth which is there. This used to be prevalent in the society before. Research has shown, in fact, that it is counterproductive. So if the pain is very acute, at the most 1 to 2 days of bed rest, but if you can get back to a normal lifestyle with good treatment, you be as active as possible, because the muscles get further weak the more you are on the bed, and the pain tends to become chronic. So be up and around as much as possible.
Should exercises be avoided during back pain, Dr. Verghese?
Acute back pain, you won't be able to do the exercise because pain will prevent you from moving your muscles. But as soon as the pain settles, no vigorous exercise, range of movement or whatever is possible within limits of pain tolerance is what is recommended. Not an overdose of it, not an underdose. Get back to normal activity as soon as possible. That's the best for your back.
Right. Dr. Chabra, is firm mattress the best option for alleviating back pain?
No, actually some people may get more pain with a hard bed, some may get more pain with a soft bed, some with a firm bed. So you have to see what works best for you. What should not happen is that the mattress should not sag in between. Very often these mattresses sag in between and that lead to back pain. So see what works best for you and customize your mattress accordingly.
Can back pain result in paralysis, Dr. Verghese?
Back pain secondary to say a cancerous deposit, secondary to a severe disc prolapse, a massive disc prolapse can lead to a complete paralysis. Yes, it is possible. So you have to look at the red flags, as Dr. Chabda mentioned. Look at the red flags. If there are paralysis, early paralysis sign, you should recognize it. Early signs of bladder symptom, for example, incontinence or rushing to toilet, urine leaks out before that, or you have chronic constipation coming on. Those are red flags that you have to be aware of and prevent the onset of paralysis.
Right. Dr. Chabra, does poor posture always lead to back pain?
It may not always lead to back pain, but it predisposes definitely to back pain. So the simple way that we say is stretch your finger like this. If you stretch it for 10 minutes, it starts paining. So once we maintain a poor posture, that puts a similar stress to that part of the spine. And that will, over the years, because the back muscles are much stronger than the muscle here, it will definitely predispose to back pain. And that is one of the most common reason, one of the main factor why back pain has spread like a pandemic across the globe now. It's no longer an epidemic, it's a back pain pandemic across the globe.
All right, with that, we end this discussion here. Thank you so much, both of you, for joining us on Wellness Watch and helping us understand spine health and its importance for our overall well-being better. Thank you so much. All right, so after the discussion, we did get some spine tingling tips and also tricks to keep our backs strong. Take proper care of your spine before pain reminds you of its importance. Caring for the spine is not just about avoiding backaches, it is about standing tall, living strong, and enjoying life without limits. Nurturing your spine today is an investment in a stronger, more flexible tomorrow. Remember, you are only as young as your spine is flexible. On that note, we'll end this discussion here and the program here. Thanks for watching. Bye-bye.